profound and heavy flooding. Essentially, people are living in open sewage. I've just returned from a 5-week mission in Bentiu in South Sudan, where I was working as an epidemiologist. It was important to get a hold on the mortality and morbidity in the area, and so we needed some people to do proper surveillance, both within the community and at the hospital. The purpose of an epidemiologist is essentially to work out, we would say time, place and person. So over what time period is something happening? So say we see an increase in deaths or an increase in some sort of disease, over what time period, who's it happening to and where's it happening. I was specifically sent to a place called Bentiu in South Sudan. It's part of Unity State, and it's quite close to the border with Sudan, and its particular relevance in the conflict is that it's very close to some oil fields, which means that it's been the site of some of the heaviest fighting in South Sudan recently. When the ceasefire ended partway through my mission, we did see an increase in shelling, in shooting nearby. We've had to visit the bunker several times during my stay there, as some of the shelling and gunfire got very close. In one particular episode, there was actually bullets flying through our camp, the UN camp. Quite soon after I arrived, the heavy rains that are annual in South Sudan started, and there was profound and heavy flooding throughout. So women were sort of knee-deep in water, having to hold their children overnight for 2 days running because it would have drowned their children. There was just stagnant water everywhere, latrines collapsing, water points completely underwater. Essentially, people are living in open sewage. So a huge risk to people's health. People who've been on far more missions than I have with MSF say it's some of the worst conditions they've ever seen people living in. MSF have been really involved in the water and sanitation efforts in the camp. So they've built latrines and actually some quite unique sort of innovations on latrines. So they noticed that children weren't using the latrines very much. So they've developed child-friendly latrines that have lower drops, that don't have roofs on, so the children don't feel as enclosed, and they've found that children are using them much more. They've also looked at things like making sure soap and water are mixed next to in the hand washing points next to the latrines, so that people definitely have access to proper sanitation measures, but also that people aren't stealing the water because water is in such short supply. During the time that I was there, the mortality rates, so the death rates in children and overall, more than halved. You could ask me why that happened. I would say that certainly a large part of that was due to the water and sanitation efforts. Simple measures that we can provide as MSF, so be it the water and sanitation interventions, malnutrition treatments, provision of a hospital, can make huge amounts of difference to people's well-being, to their healthcare indicators and to their chances of survival.